All right, so welcome everybody to our data sovereignty webinar series. My name is Carla and I am your host. We are from Treaty 1 territory, Winnipeg, Manitoba, part of First Nations Health and Social Secretariat of Manitoba. And we welcome you to this series where we feature different topics every Thursday, last Thursday of the month. This month in June, we have Dr. Taylor Morriseau, who's joining us to talk about OCAP and ethical principles. So Taylor, I'll get you to introduce yourself and then we'll begin.
All right. Hi, thanks, Carla. Thanks everyone for joining today. My name is Taylor Morriseau. I'm a Health Systems Impact Fellow with the First Nations Health and Social Secretariat of Manitoba. So with Carla and with the data sovereignty team out of our organization. And again, I'm a member of Peguis First Nation. I'm joining here from Treaty 1 territory as well, and just really happy to be here. And one of the reasons I love, working with this team and working with the data sovereignty team is really any one of us could give this webinar today because OCAP and the ethical principles are really foundational to the work that we do as an organization. So yeah, I'm really excited to chat about OCAP and our ethical principles today.
Thank you, Taylor. All right, so we'll get started. So I know we're talking about OCAP and ethical principles, but I want to pose a question to you about what is important when doing research with First Nations communities, individuals.
So yeah, I mean, it's a great question, and I've prepared some slides in response to, some of the questions that we're going to chat about today. But I think in response to that, about when doing research with First Nations, what is really important and what it's critical to remember is that research is a relationship. And as many of us know who are kind of engaged in research or the research ecosystem, these relationships between, non-Indigenous academics and First Nations communities have really been historically undermining First Nations self-determination. In many cases, researchers build these long and successful careers, while communities have received little to no benefit. And in some cases, and even worse, they've been exploited through the research process. So as quoted, beautifully by an AMC elder back in 2005, we've been doing this for quite some time. Research is a relationship based on respect, and it takes time to build trust. So there's a couple key, words here is research, relationship, respect, time, and trust. These are really foundational to the research that we lead as a First Nations health organization, and really the basis for the ethical principles that we'll talk about today. But just keeping this quote in mind as we go through some of the questions today.
Thank you. So I know part of the base of this is the Health Information Research Governance Committee. Can you just explain for those that might not have joined very briefly about how it came about? Because it's kind of it connects to the OCAP and as well as principles.
Yes, so the Health Information Research Governance Committee, or HIRC as we call it for short, is a research ethics board that reviews research from all across our region, so in Manitoba, that either pertains to or has implications for First Nations. So the committee itself is composed of representatives from the North and the South, with directives in health, education, socioeconomics, environment. And they also have a youth and an elder representative. And so it's a really unique committee that not just in, although it's called the Health Information Research Governance, they have directives across all kind of demographics and different regions and different kind of opportunities. But really at its core, what HIRC does is to provide advice and guidance to researchers. So for researchers that might have good intentions, but may be missing some points or maybe unaware of how their research could be harmful when working with the First Nations community. But more importantly, they provide a thorough review of research applications. So any research applications that pertain to First Nations people or that use First Nations data. For example, the Manitoba First Nations research file that I'll talk about sometime throughout this presentation. But really, HIRC has the power to approve or deny these research applications. So in contrast to something like a university or a hospital or an academic research ethics board that usually looks for things like institutional liability, HERC is a lot different, and they review these research applications based on 4 ethical principles. And these are ethical principles that are defined by First Nations. And again, if these applications don't meet the ethical principles as defined by the nations, they do have the power to deny their approval. I'll keep going on HERC, sorry. So just to remind everyone, if you're unaware of what HERC does or haven't encountered HERC in your research before, it's been around for a very long time, actually. And so HERC was established in 1998, again, as that First Nations Research Ethics Board, but it was originally mandated to oversee the Regional Health Survey. So this is a health survey that was really came about because there was huge gaps in First Nations data for First Nations living on reserve and required some ethical review. And so over the years, as you can see in 2007 and again in 2009, HERC's scope has really expanded by the Chiefs and Assembly of the Assembly of Manitoba Chiefs in order to formally give HERC that power, and again, as a mandate to gatekeep First Nations data at the regional level. So as a committee, again, HERC kind of ensures that all research carried out on a regional basis abides by the 4 ethical principles. And it also really ensures that, so there's free, prior, informed consent in order to ensure that these align with community needs, benefit OCAP, and ultimately really uplift First Nations self-determination. Now, as a gatekeeper of First Nations data, what I think is really important about HERC is it has set a really incredible precedent for First Nations data governance. We see First Nations data governance and data sovereignty as big topics of conversation in the kind of the research ecosystem today. But we've been doing this for over 20, almost 30 years. And our goal through these webinars and our goal through the work that we do as a data sovereignty team is also to increase the awareness and recognition of HERC within the kind of the research ecosystem and data sovereignty landscape, because it has been a really wonderful model and can serve as a model for other regions. And one of the reasons why we have such strong belief in HERC and the work that HERC does is because we've got resolutions from our leadership. So these are Chiefs in Assembly in Manitoba that support FNHSSM's work in data sovereignty, as well as the HERC committee, again, since 1998, as you can see the very first resolution there. So if you're unfamiliar with resolutions, the resolution process is a means for First Nations governance and decision-making that can support our research. And so this is really different from the way that kind of academic research operates. So whether you're an academic that kind of does research investigator-driven or in response to, sometimes targeted grant funding, instead, the way that FNHSSM and First Nations-led research operates is through these resolution processes. And so you can see some of them that are outlined here, is including that Manitoba First Nations Regional Health Survey, again, a survey developed by and led by First Nations for First Nations to collect data about us. Again, and you can see in 2003 down here to support a one-of-a-kind key link data file. So this is a key link data file between Manitoba Health and the University of Manitoba and FNHSSM, and that permits the linkage of administrative health data with the Indian Status Registry to identify First Nations and their health outcomes, also related to social education, justice, etc. So again, a really big scope, wide scope of practice for HERC in this regard with respect to data governance and maintaining power and governance over health data that is maintained at the University of Manitoba. And lastly, you can see this one in 2003, the last one kind of highlighted there, is again, as HERC has expanded and as the mandate has expanded, our Chiefs and Assembly have supported these increasing mandates as a means to keep pace with new research demands. And so we see more research coming for First Nations, or First Nations encountering more research applications, but also First Nations leading their own research, and also new evolving technologies that we need to keep pace with as First Nations in this space. And so my intent with this slide is just to show that First Nations self-government is required for meaningful community-driven work, and that is something that we are ultimately committed to. And as again, the Chiefs and Assembly have also supported this work as a First Nations-led organization working collectively on behalf of our communities. And conceptually, just understanding what a difference this makes from our own self-government, our own research ethics board, and how this changes the research outcomes.
So I know you talked a little bit about uh, I think you touched upon some of the principles, but I want to ask is like when you think about respectful relationships with First Nations uh, in our Manitoba region, what are the 4 criteria that we follow?
Yeah, so I mentioned them briefly, but today we really want to go a little bit more in depth with the respectful research criteria. So again, similar to other RABs, HERC reviews research applications that pertain to research about First Nations. But unlike these other RABs, HERC reviews these applications on the basis of these 4 principles. And so these principles are free, prior, informed consent, First Nations ethical principles, First Nations principles of OCAP, so ownership, control, access, and possession, and then First Nations benefit. So these are 4 principles. A lot of different regions use either just OCAP or they may have OCAP and plus or minus a few other things. In Manitoba, these are the criteria that have been established again for and again mandated for the Health Information Research Governance Committee to use in their review of research for over 20 years and have proven very successful in that regard.
Let's start off with free, prior, informed consent. So when we take a look at that area, what does it include? But also, what kind of questions should be asked?
Great. So free, prior, and informed consent, we can shorten it just to call it FPIC, for example. FPIC outlines how both individual and collective community consent must be, one, voluntarily given. So this has to be without coercion. It has to be free of these kind of unrealistic and externally imposed timelines. It has to be prior, so consent must be sought sufficiently in advance of any research project that happens, and informed. So First Nations must be truly informed of the entire scope of the project, not just pieces of it, not just kind of the cherry picking the good things that come with a project. And it has to happen before the project starts and again throughout all of the stages. So FPIC is really important because it is an inherent right of Indigenous peoples. And so it's not just, oh, nice to have. It is really truly an inherent right as sovereign peoples and is recognized by the United Nations Declaration on the Rights of Indigenous Peoples. And so it allows First Nations to give or withhold a consent to a given project. So whether it affects their territories, whether it affects them as a community, it really enables First Nations to negotiate the conditions under which the project will be designed, implemented, monitored, and evaluated. So although FPIC may be familiar to some of you on the call today, because you've seen it in relation to things like environmental resource extraction or things where it's more concerning environmental. The HERC committee uses FPIC as a means to evaluate consent prior to the approval of any project that affects First Nations. So it's not just an environmental use, it is really free, prior, and informed consent for all projects that affect First Nations. And as one of the ethical principles for respectful research in Manitoba, FPIC really requires and ensures that First Nations have inclusive participation throughout all stages of the project. So engagement is not just an afterthought, rather it's that foundation to building a trusting relationship that affirms sovereignty. So again, thinking back to that quote from the beginning, how do we build a trusting relationship and affirm sovereignty? Free, prior, informed consent is one mechanism to do that. So to evaluate a project's commitment to free, prior, and informed consent, HERC asks many questions in their application when they're evaluating a given research project. And these include, one, does the research team have an established relationship with the First Nation, or are you seeking to build a relationship? Two, if you are seeking to build a relationship, when and how are you seeking free, prior, and informed consent from the community? And then how are you ensuring free, prior, and informed consent on an individual basis? So as you can appreciate, these questions evaluate both collective community consent and individual consent. So free, prior, and informed consent is not just one or the other. It's really inclusive of both types of informed consent. And it's not just a box ticking exercise. So you can't just ask, do you have a band council resolution? The HERC really requires you to provide a description of the free, prior, and informed consent between the communities and the research teams that are involved in order to really assess and flesh out whether free, prior, and informed consent is being, is being respected in that regard.
So another area that we have noted was ethics. And I know in Manitoba we have 5 nations. Can you explain a little bit more about that area of ethics and why that's important, but also some of the questions that might be asked when it comes to this area?
Yeah, of course. So, with respect to First Nations ethics, this is again one of the primary principles that HERC uses, and it's required because there is so much diversity and plurality when it comes to First Nations communities, First Nations languages, and organizations within our region. And that's like every region, there's a lot of diversity housed within. So in Manitoba, we have 63 First Nations communities. These are split into 7 tribal councils, as well as those who are independent, as well as represented by 3 provincial territorial organizations. And so this is really important because each First Nation and each nationhood have really distinct histories, identities, realities, different political interests, and different jurisdictions that need to be taken into consideration when conducting a research project. So when HERC reviews a research application, this also means that the ethical standards as defined by the First Nations community or nation supersede any institutional or government ethical standards. So I'll say that again. Any ethical standards put forward by the First Nation supersede the government or institutional ethical standards. And that is a mandate that HERC abides by very strongly. And perhaps most importantly, this ethical principle also requires that researchers engage with the ethical standards of these individual nations in order to reduce the risk of pan-Indigenous research. So if you're not, don't really understand what pan-Indigenous research is, this is research that kind of lumps all Indigenous folks, whether it's Métis, Inuit, and First Nations, or all different First Nations groups, whether you're lumping Dene and Cree and Ojibwe all together. That really serves to flatten those diverse cultures and realities again into that single Indigenous identifier. And because of this, HERC does not support pan-Indigenous research, but any project that applies to HERC that uses that one single identifier will not be supported because we know that leads to erroneous conclusions. We know that leads to possibly harmful interventions, and we know that can perpetuate health inequity. So this is a really important ethical standard that HERC evaluates quite strongly because of that risk, again, for that pan-Indigenous research and that risk of not abiding by the ethical standards of the nations themselves, and rather just kind of falling back on those institutional REBs and having approval from, different other REBs or different other groups, and they think that's sufficient when we know that it's not, and we know that can be harmful. So in order to evaluate the First Nations ethical principles of the different nations or of, what that project looks like, it is really case dependent, but researchers should be able to describe or did they learn about the community organization to engage in the research? So can they actually describe that relationship? How do they plan to consider the ethical standards of the distinct culture and language groups that will be used within the research? It's not enough just to say, oh, we plan on engaging Indigenous folks. It's really, what about the cultures and the languages? How are you going to engage that? And is it going to be reflected in the research project? Is it going to be reflected in the data analysis? And is it going to be carried throughout into the outputs that come with the research? And then how will their research consider the unique cultural practices and jurisdictional challenges with First Nations? Again, those jurisdictional challenges are different for First Nations, Inuit, and Métis, but they also differ within the First Nations context. And so we know some communities are remote, some have different accessibility challenges, some have, it's so diverse, right? So we need to make sure that the research is considering that when they are applying to HERC. And then lastly, can they explain the historical, cultural, and traditional context that will be included in their research? And again, that traditional context is really important. We know when we're engaging with elders and other knowledge keepers that having that spiritual foundation to the research is just so critical. But the researchers need to know who they're engaging with, right? They need to have the ability to describe that relationship. They need to know who their knowledge keepers that they're engaging with. They need to know the credibility and all of those different things in order to make sure that they are telling the true story, that they are reflecting that story in their research, and that will be respected throughout the analysis and the output.
So another area that was mentioned was First Nations benefit. Why is that so important? But also, what are some of the questions that are asked when it comes to benefits for First Nations?
So benefit to First Nations, this is one of my favorite ethical principles, if I can have a favorite. because research we know has been primarily conducted by non-Indigenous researchers, and again, because of that potential for harm, both communities and individuals, the Health Information Research Governance Committee really makes sure that any research being done in Manitoba has a benefit to the First Nations. And a lot of people will say on their HERC application, oh, the benefit is that we'll have change in policy, or the benefit is that we'll potentially find a new mechanism that may potentially lead to a new pathway that could, improve health in 20 to 30 years. And those things are benefits. I'm not going to undermine that. But we really need to see more tangible benefits in the short term that really uplift First Nations people in the design of research, because we know research is a very well funded, and a lot of researchers have flexibility in their budgets to some degree in order to make sure that First Nations people and the communities themselves are actually having direct benefits. So the first one here is that providing honorariums to partners and participants for their time and support. Really, they are the experts with respect to the research that's happening in their communities, and so being able to provide compensation in a degree that is respectable, but also things like childcare, transportation, other supports that should just be really fundamental. Access to services, that's what we see a lot with. Our team has done a lot of engagement with, for example, First Nations youth. And that access to services is something that we often overlook, but it's something that is so desired, especially by our young people, and having that direct access to those healthcare services. And if you're doing a research project that has, the ability to provide that, it should be core to that, to what you're offering, as well as spiritual, mental, and emotional support. So those things cannot be overlooked. I think especially with like health research and a lot of clinical research, we think a lot about the biomedical, but not so much about that spiritual and emotional support that we need to provide when we're opening up any sort of potential for harm, right? So if you're thinking about a clinical research project that might touch on anything, really, you need to be able to provide supports when you're opening up those potential for wounds. Secondly, is that involvement and capacity, right? So hiring and training members of the community that you're working with is one really easy, but also so meaningful mechanism in order to involve the community. So whether that's a research assistant, training data analysts, hiring translators for the different, again, those 5 different languages, it supports education. And so it supports that capacity building. It really involves First Nations as those project partners. And so not just saying that, you're the experts in this project, but really having that involvement and ownership over the project through the hiring and training. And one of the ways that you can also do this is the formation of an advisory committee, and it's something that the Health Information Research Governance Committee also asks about, is how is the community involved in that work? So is it through an advisory committee? Is it because they're a research analyst? Is it all of the above, even better? I think we can't have enough First Nations benefit. Third is recognition. So we know as researchers, we often strive for that authorship. We strive for that, how do we get recognition for our work in this kind of larger research ecosystem? But really, if you're involving the community meaningfully, if you're training those folks to be to be the data analysts, to be a research assistant, they need to be just as much involved in that authorship and that participation in the result sharing. So whether that's an academic publication, whether that's a conference, whatever that looks like, making sure that those folks are just as much involved in that ownership of their data and ownership of their intellectual property rights. Again, that affirms Indigenous knowledges and ways of doing. So if your project, uses completely westernized methods, and you start to involve the community and you start to hire different analysts and things like that, they'll see the data through another lens, and they'll really come at it with their own understanding, and it will totally change the research outcomes. You'll be surprised. But then what's really beautiful about that is it really affirms Indigenous knowledges, because it just changes the way that research is done, and it makes sure that Indigenous folks and their ways of knowing are actually respected throughout the entirety of the research output. So if you're publishing all of a sudden, and you're publishing Indigenous knowledges as one can publish Indigenous knowledges with respect, and making sure that it's done in the right way, but it really affirms that way of doing. And lastly, the system, right? So we're always trying to change the system. We're not using our research to interrogate people. Really, we need to use our research to interrogate systems. And how do we better design our systems to fit the community's needs and priorities? And so whether that looks like investing in community infrastructure, whether that's advocacy, or whether, again, that's kind of, we're going to change policy. We're going to look at changes in structure through our research, and we're going to do that in the, working with the First Nations who are involved. Oops. So one of the ways that the Health Information Research Governance Committee looks to, they really go more in depth with all those 4 different areas, but they quite, broadly ask, how will the research benefit First Nations, and will their research be investing in infrastructure or human resources and expertise of the community or organization? So those researchers really have to do a good job of answering these questions. Again, it can't just be one area. It needs to kind of look at all 4 of these different areas. And so understanding not just changes in policy, or we're going to provide honorarium, but this entire direct benefit, involvement and capacity, recognition, and systems. That's it.
So I know that we went through about ethics, we talked about FPIC, free prior informed consent, benefits, and now we have OCAP. And I know a lot of you who are with us, joining us, might know about OCAP, but are you able to tell us a bit more about OCAP and what it stands for?
Of course. So yeah, I expect a lot of folks on the call today to maybe be familiar with OCAP, so ownership, control, access, and possession. And I also want to preface this section by acknowledging that the First Nations Information Governance Center, or FNIGC, does have a newly updated training available for the fundamentals of OCAP. So it's available online. Just search FNIGC and OCAP. You can find it on their website, and it provides a far more comprehensive understanding of these principles. We'll touch on them today, but I really encourage anybody who's listening to just enroll in that training. It's amazing. It's really, really well done. So just quickly again, today we'll cover ownership. Refers to the relationships of First Nations to their knowledge, data, and information. So the community or First Nations group, whatever that looks like for the project that we're designing, needs to own their information in the same way that an individual owns their information. So it's just a fundamental principle of ownership. Control means that First Nations people, their communities, and representative bodies must control all aspects of information management. So it's a wide scope of control, right? So it's, how do we define it? How do we collect it, use it, disclose it, and destroy that data? That is control, and First Nations, again, need to have control over all aspects of that data management. Access means First Nations must have, again, access to their information, but also management of the information and data about themselves, regardless of where it's held. So that's a really key point there. So even if the researcher is holding the data, the First Nations who are involved must have access to the data about themselves. It cannot be, housed away or stored away somewhere that is inaccessible for First Nations. And that's what we often see. And then possession. So this is the stewardship of the data. So it's different from ownership in the way that stewardship is a mechanism to assert and protect ownership and control. So even if you don't have direct possession of the data, if you don't have direct ownership of the data, possession means that you have data within First Nations jurisdiction and therefore within First Nations control. So it doesn't just mean, obviously all parts of OCAP need to be respected, but sometimes we see, again, because either communities don't have the bandwidth to support all of this data and can't physically own it all within their community, we see a lot of sometimes possession and stewardship being more important when we're thinking about the principles of OCAP. So HERC and FNHSSM, the principles of OCAP are not ours solely. Again, a lot of different regions use OCAP. It is a trademark that was coined by the National Steering Committee of the First Nations Regional Health Survey back in 1998. So again, a lot of these things precede even some of the ethical principles that we have today. And so the reason why OCAP came about was because community privacy and information governance were not being protected by Canadian privacy laws. And we still see this today. We still see a lot of challenges when we're trying to negotiate and work within the Canadian privacy laws that are not respecting First Nations sovereignty. So unfortunately, because they are not legislated at this point, OCAP is simply a tool to support information governance. And again, there's immense diversity among First Nations. So these principles will be expressed differently depending on the nation, depending on the context. And again, the reason why OCAP was really emerged is because of that harmful and intrusive research relationships that have occurred between non-First Nations researchers and governments and First Nations communities. So there's a lot of different harms that we know are, happen, and I can go through some of them. So First Nations people being treated as data points, that lack of regard for cultural context. Again, that research that's not being shared with communities in an accessible and effective way, presentation of data that's out of context, again, resulting in those inaccurate conclusions. And that's what one of the biggest harms that can come from that pan-Indigenous research again. Researchers having ownership and power over the priorities and outcomes, improper consent protocols, so not respecting FPIC, for example, sensationalizing First Nations challenges and context. How often have we seen that in the news, right? And then no benefit. So that First Nations benefit, again, is implemented within that principle of OCAP as well. So it's a tool, it's a protocol, it protects First Nations people from those harmful, insensitive, and exclusive relationships, and it helps us control our information so that we benefit communities and we respect First Nations protocols and practices. So OCAP, again, it's so large, it is inclusive of the other ethical principles that we've talked about today. And again, please enroll in that online training because it goes through all of these principles in really, really excellent detail.
So I have put the training link in the chat box below. But I know, and thank you, Taylor, for going through the description of OCAP. Let's start going through the questions of what people should ask. Let's begin with ownership. What kind of questions should be asked when it comes to ensuring that this is done correctly?
Beautiful. Yeah. So one of the ways that we can look at ownership is how are First Nations identified in the data? How will their identification be confirmed? How do we know that you're identifying First Nations correctly? Who will own the data and how will that be established? That's a huge question that often university REBs and others are not asking yet. How will First Nations be acknowledged as contributors in publications, reports, and presentations? And does the project include any other First Nations groups within or outside Canada? So we see a lot of, regional projects, but we also see projects that are, pan-Canadian or international Indigenous projects that want to include First Nations groups as well. That doesn't negate ownership, right? So we need to have First Nations remaining owners of their own data, and that stems from First Nations being identified in the data. So it goes back to question one there, because we see, oh, we want to do this pan-Canadian project where we're going to collect First Nations data. We're going to have them check box, are they First Nations? And we'll carry on. But unless you're actually identifying their region, their context, again, their traditional jurisdictions, we need more data in order to have ownership of that data. So a lot of researchers try and get around the ownership question by simply kind of having too vague of data, like, oh, we just had an Indigenous identifier, so who really owns this? Well, I don't know, you don't know, and then we just kind of go about our day. We need to have ownership being respected from the point of data collection as well. And that also includes First Nations kind of defining how that identification is being done. So that second question there, how is their identity being confirmed? And that needs to be governed again by the First Nations themselves. So that's a lot. Ownership is definitely kind of a hard but really important principle that a lot of researchers do struggle with, is that point of ownership. But one of the ways, again, is that ownership can be asserted is through those contributions to publications, reports, and presentations, for example. It's an easy way to allow First Nations to have that ownership if they're talking about the research themselves, if they're the ones doing the reports, if they're the ones doing the presentations. It is one of the easiest ways, I would say, to kind of assert ownership in that regard.
Let's take a look at control. So when we take a look at that area, what kind of questions should be asked when it comes to control?
Sounds good. So control, again, this means that First Nations have to have control of their data to begin with. And then secondly, how will First Nations govern their data? has an information sharing agreement being developed. So an information sharing agreement is a tool that allows First Nations control. If you don't use information sharing agreements, also called ISAs, within your research, I would highly recommend looking into this. FNHSSM, our data sovereignty team, can support that in regards to developing an information sharing agreement so that First Nations retain control over that data. And then how will decisions be made for the use, access, and dissemination of First Nations data? So for example, HERC, again, controls the data that comes through Manitoba Centre for Health Policy, that administrative health data, through that key linked file. So if you want to use that data, a First Nations-led research ethics board controls the use, access, and dissemination of data, which is, again, really important for First Nations data governance. Fourth, are there multiple First Nations communities involved, and how will each individual community control the data that pertains to them? Will other communities have access and control of other communities' information? Those are questions that have to be sorted out when you're conducting a research project. 5, what is accountability to First Nations? And 6, how will First Nations be involved in data analysis? So again, going back to like hiring data analysts, training them, that's again supports First Nations control over their own data. But again, there's so many different layers of control that go back to First Nations, again, having the power to control that and then having the tools in order to retain that control. So whether that looks like an information sharing agreement, whether that looks like First Nations data analysts, there are a lot of methods that First Nations can use to gain that control and to maintain that control.
So we went through ownership, we went through control. Let's talk about access and some of the questions that should be asked when it comes to this area.
Sounds good. So again, access, making sure that First Nations have the ability to access their own data, whether or not it's stored within their community or not. So one, what is the process to ensure the privacy and confidentiality of the information and to notify First Nations if a breach occurs? We're seeing this so often, right? We all get the emails saying there's been a breach in data. If you're the one collecting the data, what is your process for confidentiality, and what is your process for notifying First Nations if and when that breach occurs? Secondly, what is a process for storage and destruction of data once the project is complete? It's not just enough for that, free prior informed consent to say, oh, we've engaged, we've started that data collection. Have you thought about the storage and destruction of the data once things are done? Who has the ability to make that decision? And again, if you're not already following, it should be the First Nations who are involved. Third, how will First Nations access their data? What does that look like? Is it online? Is it housed within a server? Where is that server located? Fourth, how will the data should be shared outside of the project? And again, who makes that decision? 5, who will have access to the information? So obviously the First Nations need access, but who else are you going to be sharing that information with? Are you going to be doing secondary data analysis? Or do you have a data access committee that will decide that whether or not that's permissible or not? And 6, are there any policies to develop to protect First Nations data? And so when we're working with different data collection softwares, we often see that they don't really respect OCAP, for example. A lot of, whether it's electronic medical records or different systems that we use to collect data about people, they don't automatically respect OCAP. And that's where a lot of the challenges that we see are currently lying, because those policies are really gray. They've been really written to privilege the collection software, or the folks who are developing the different means to collect data, and they don't privilege First Nations people in that regard. And so that's more of a legal issue at this point, but developing those policies, if you are able, within your data collection system, or thinking about that more thoughtfully when you're engaging with data collection, looking at those policies and procedures and how we can better uplift OCAP in that regard. That's
And of
access.
course, we've come last to possession. So with possession of the data, are you able to explain a bit more with the questions that should be asked?
Sure, this one's easy. Where is the data? Where is the data going to be held? If the data is not being held by First Nations, how are you going to ensure that the data is stewarded by First Nations? So again, not all First Nations have the capacity to hold their own data at this point. We are still working in that area to ensure that First Nations have the infrastructure and the human resources to hold their own data. But if you're at the point in a research project where you're holding the data, what are you going to do to make sure that First Nations steward that data? So just because they're not holding it physically, how are they stewarding and how are they making decisions about that data? Which is really, really important. But that's possession.
All right, so we've went through the four principles. The free, prior, informed consent, First Nations benefit. We also went through the
OCAP.
OCAP, and then the fourth one we went through. But can you just recap and perhaps give us a little bit more about some of the, I guess, some reflections, last minute reflections about the four principles?
Right. So again, the four ethical principles in Manitoba are free, prior, and informed consent, First Nations ethics, First Nations benefit, and OCAP. So this is unique in Manitoba because we do have these four principles that are used in the ethical review of research by the Health Information Research Governance Committee. Again, OCAP is more widely recognized and more widely implemented within the research ecosystem. A lot of folks, regardless of what region they're in, typically have encountered OCAP before. And starting to have a better understanding of it. And again, there is now more accessible training and there's more awareness of OCAP. But in Manitoba, we do want to raise the awareness of the other ethical principles that we think about quite regularly. So that free, prior, and informed consent, those diversity and the ethics within different communities, and then First Nations benefit. So making sure that those are also involved in the research conversation and that different researchers are abiding by them. So I was before I joined the data sovereignty team at FNHSSM, I was a member of the Health Information Research Governance Committee for some time, and I did review research projects with the larger committee again that has a lot of different representatives and a lot of diversity within that committee to look at these four ethical principles. And I'll say that researchers, as well-intentioned as they are, there are still a lot of gaps. And the point of these ethical principles is not to slow down the research. It's not to get in the way of, research happening. And we know that especially clinical research happens at such a, fast pace, the clinical trials, things like that, that we want to see more movement. We want to get solutions quicker. We want answers faster. These are not to get in the way. These are to make sure that First Nations as sovereign peoples are actually involved, they're engaged, that they benefit, that those ethical principles are respected, and that data and the results from that research are actually benefiting in a way that, not just the researcher, not just the research team, not just the university, really truly benefiting the First Nation. And I think that's one of my biggest reflections is that a lot of researchers still see these principles as slowing down the research. And that's such a barrier when we're trying to engage with the research ecosystem because a lot of First Nations are doing their own research now and are, really that education and that training and everything is coming together to such a beautiful point where we have so many First Nations scholars doing the work ourselves. And these are just embedded within, like when you see First Nations scholars and First Nations organizations leading research, a lot of these things are top of mind that are just embedded within the research. And even First Nations scholars go to HERC, right? So they still apply to HERC. But reading a First Nations, led application is a lot different from reading, a non-Indigenous. We just started to engage with this community. We're still figuring out the advisory committee. What's the difference between an advisory committee and a data access committee? They're still working through a lot of those questions where, these things just are top of mind for First Nations folks. And so one of the best ways to just abide by these principles is to really diversify your team, making sure that you have those First Nations scholars being part and leading that research is just so fundamental. And I think we've got such a beautiful capacity in our region now to lead this research that there's really no excuse not to involve Indigenous folks and to train Indigenous folks. So those are some of my reflections. I think, we're not anti-research at FNHSSM. We do our own research, for example, but we're really pro-sovereignty. So making sure that these ethical principles are abided by as a means to uplift First Nations self-determination. And that is what is most important.
Some
So
some last minute reflection questions for people to think about.
I beat you to it. So questions to think about. How do you plan to incorporate ethical principles from your region? So this is Manitoba. This is what we've thought about for 20 years. These are the ethical principles that have come through within our region, but all regions look different. You know, we need to be thinking, we need to be engaging, and we need to be constantly going back and asking, do these things still make sense? We see a lot of technologies evolving. We see like disruptive technologies. We're facing artificial intelligence and other things these days. Do these ethical principles still apply, or how do we need to expand them? What do we need to think about? And then also, how do you plan to incorporate OCAP? So again, OCAP is more widely recognized these days. We've had a lot of time to sit with OCAP and to think about incorporating OCAP into the research. And a lot of even funding agencies like CIHR and others have started to ask about OCAP. So again, no excuse not to be thinking about OCAP at this point, but how do you plan to meaningfully incorporate OCAP into your research?
Wow, that was a lot. That was amazing. Thank you so much for all the reflections and all the information. I just want to open it up to see if there are any questions regarding what we went through with the ethical principles. And I should know this, but right now it's 5:46 a.m. where I'm at. So I woke up to do this. I plan to go to bed right after this. But we do have some upcoming webinars. And if you do have any questions, please type them in the Q&A box. But the upcoming webinars that we do have how to set up a research governance committee for an organization or community. That's in August. And in September, we're going to be telling your story through data. And we are skipping July just because we are busy. Our team is busy in July and it is summer months. But if you have any questions, our information is here, our phone number, but as well as you can reach us at FNHSSM data sovereignty at FNHSSM.com. This will be also provided through recording. So if you'd like the recording or if you would like copies of the presentation, please feel free to send us a message. We thank you so much for joining us. Dr. Taylor Morriseau, we thank you so much for providing such beautiful insight and making us think about 4 ethical principles. I want to wish everyone a great day. And at the end, you will see a survey pop up. We kindly ask you that you fill out the survey. And if you have any further questions, please feel free to contact us. We wish everyone a great day.